Hello, everybody. Thank you so much for joining us. This is Curated Conversations with GRAAHI, a podcast that talks all things health. My name is Tiaja Martin. I don't think we've had the chance to meet, but I'm so glad that you decided to join us today. And I serve as our Director of Education and Access to Healthcare Careers. The Pathways Department brings education and career readiness, tools and resources from our third grade students all the way up to adult learners. Today's episode, though, introduces our infant and maternal health initiative, Black Womb Workers. And I will share more about that at the end of the episode. But today's episode is hosted by myself and our outstanding post-secondary specialist. Please introduce yourself.
Hello. I am Ashley Starr. As Tiaja said, I am the post-secondary engagement specialist at GRAAHI. I am so excited that we have Pastor Denise here with us today. It's such an interesting story. So much background that we can't get into now. But back in March, Tiaja and I had the opportunity to go to the National Black Midwives Conference in Hampton, Virginia, where it just opened up this magical world to doula and midwifery and just so many things. And from there, that just kind of got us connected with Pastor Denise, and that led to a meeting where she just provided more education and knowledge. And it's just, we were so excited. We were there, we talked for hours about our first meeting. So we'll take you back to the beginning. Pastor Denise, when we first met, you showed us these keychains that I have here. And could you just give us a little bit of insight and tell us more about the purpose and how they're beneficial?
Yeah, well, you know, I am just extremely passionate about all things birth.
Yeah.
My daughter, who you probably get to meet sometime, is studying to be a midwife. We're both trained doulas and birth doulas. And I've just come to realize that this is just a fantastic world, as you described. It's such a magical and gift that the body can do what it does by God's grace, right?
Yeah.
And so as I've become more and more aware of the disparities around birth, particularly as it relates to Black birthing people, I like to say birthing people just to be inclusive in that way. I realize that there's just not a lot of information. I think that people just kind of, like myself in many ways, just you get pregnant, you have a child, and expect for the medical system to sort of navigate that for you, when in fact we actually do have agency. We do have some sort of voice over birth, over our own birthing experiences. And so what I started realizing is that as I tried to enter into these conversations with people, they didn't know what a doula was. Yeah. They didn't know what their options were. Mm-hmm. And so I thought, well, what is the best way to kind of get something that might be life-saving into the hands of the birthing people? And so the idea of the keychain with the QR code came up, and I thought, well, if I can create a birth plan, then my point of entry in every conversation is not, do you have a doula? Do you want a doula? It's, do you have a plan for your birth? And so anybody can relate to that.
Yeah. Yep.
Right. And so often, most of the time, people will say, no, what does that mean? And I'll say, scan this code, and there's an actual template for a birth plan that will come up that they could utilize on their own. Right. So they don't need anybody to navigate it or anything. They just simple things like some people don't like their feet touched.
Okay.
Right. And that can be included in the birth plan.
Right. So you put that in the birth plan. So now the doula can help communicate to your nurse or your provider, well, she doesn't really like her feet touched, so please try to avoid that. And then she doesn't have to be the one to say that. We'll talk more about that when we talk about the role of a doula. But even if it's not a doula, if you don't want a doula, just to be able to think about, do I want the lights on? Do I want the lights off?
That's good.
And just by opening up this door, it has given so many birthing people that I know an option to design what they want, their room, their space, when they welcome baby into the world, right? What music, what song do you want playing? What prayers do you want prayed? What, and so all of a sudden it's like, I have some volition and some say over this birth. And then if you scan the QR code, you also get directed to a link that will say, are you interested in having someone help you with this?
Oh, wow.
Good.
You might want a doula. Now, all of a sudden, so instead of using the doula language that's obscure to so many people, we just come right in with the common language of birth plan and somebody to help implement this this particular plan that you have. And so just seemed to be just a really easy way.
How much do birth plans cost again?
Birth plan is free.
Whoa.
I said birth plan is free. Right. I mean, there's templates like, you can get as sophisticated as you want to get, with it. But this is just a basic one. But a birth plan doesn't cost anything. It's just a template to help you think about what that birth experience might be like. I remember one of my friends went in for a C-section, and as she was going in, the doctor said to her, are you okay with having this student in the room while you have your procedure? And she's a Latina, and she was worried about how her response would affect her care. That's right?
So powerful.
So had she thought about it beforehand in a birth plan kind of situation, she would have been able to think through and say, I don't want any stranger to see my baby who doesn't need to. So she said yes at that time. And I can't tell you how many times we've talked about this over the last 4 years. I think her child is 4 now. How many times she just felt so... She felt blindsided. She felt pressured, and had to make a decision about something that she really wouldn't have wanted that student in there. But she didn't want it to affect her care. She didn't want to be perceived as a problem.
Yeah.
And so again, having that birth plan in place helps you to already have answered that question, right? And it also, if you have a doula or you have a significant other, somebody who's walking alongside of you, they already know because you already talked about it, and they can speak up and advocate and say, we'd rather not have anybody view our baby before we do, unless it's absolutely necessary medically.
Yeah.
I think that's good because I don't think people know that you don't have to be a birthing person to have a birth plan. So you could just be a family advocate and bring up the conversation and say, do you have a birthing plan? Oh, wow.
Yes. So again, that's also the benefit, because once you have the QR code, you can share it broadly in any way you want to.
And I would imagine that while giving birth, there's so many other things that's going on, in the room. But if there's something there that's just like, nope, this is the script we're kind of going to stick to, that it helps keep things on track and, and like help make the things that you wanted a priority, a priority.
Yeah. I mean, especially like the bigger things. So, just dovetailing right into the conversation about doulas, the bigger things, because all of a sudden, you're in the room and the doctor says that you need to be induced. And you don't even know what questions to ask. So that's where the doula comes in, because the doula's already met with birthing person prior to birth, the day of birth, right? And so we've already kind of talked through some of the scenarios and used some real data-driven information to try to help make an informed decision about what are the implications of being induced. How does that affect your milk flow? Wow. If you're trying to nurse right away, how does it? So not really trying to tell, doulas don't tell birthing people what to do. We just try to provide the information that can help them make a real informed decision. Okay. But often in a hospital, you may know that it can be kind of rushed, right? It can be kind of like, okay, we're going to induce. And I have to ask people, why are you being induced? And, because, they said I'm too small or too short or too whatever. And so do you want some research about the implications of that? So that the birthing plan is not just off the top of the head, but with the doula, you actually are getting some points of data that can help that birthing person make a good decision.
Yeah, so let's dive a little bit more into that. We briefly talked about, how so many people just don't know anything about doulas and everything. I am some people, so many people like, yeah, right. So it was like one of those, you had heard the word, you kind of sort of knew what they did, but after we went to the conference, just like you realize how much you just did not know. So can you help provide a little bit more insight of the many different things that doulas can do? Like what services they provide?
You know, doula literally means to come alongside, right? So a doula can be in any aspect of your life. A doula can be like a coach, you know, kind of function that way depending on, you know, if you're concerned about career or something like that. Typically when we talk about doulas, we're talking about birth doula, we're talking about breastfeeding doula. There are death doulas.
Yes, I
right?
just heard about that.
So there are a few different kinds of people who come alongside, but in the birth industry, in particular, I was trained by Doula International, kind of an organization I think that kind of put doula on the map in a real professional way. And our training included birth doula and breastfeeding doula, and with a little bit of like aftercare doula, like
postpartum
doula. Yep. So why have a doula? I think every birthing person should have one. Actually, that's what it says on the keychain. Birth plan saves lives. Every birth giver should have one. Every child deserves one. I think every birthing person should have somebody alongside of them, particularly for our Black birthing people, because we know that there are disparities.
Yes.
We know that there's implicit bias.
Yeah.
And we know that these things contribute to exponential rates of infant mortality.
Yep.
And also birthing person mortality in the Black community. So more than, I would say more than any other demographic, a doula can be a life-saving agent, simply because the doula will help the birthing person to determine what their plan is, and will be the person in the room to help make sure that plan is enacted in real time. So that gives the birthing person some relief to not have to think about all of those things in real time and really focus on birthing. That also gives the partner some time and space to really give attention to the birthing person and to not have to navigate all the other moving parts and pieces. What is the role of the doula? Whatever the birthing person wants.
Oh, that's powerful.
Whatever the birthing person needs. So say if the birthing person's mom is there in the room, the birthing person maybe not be able to eat because some hospitals don't allow you to eat in labor, but mom is hungry. So the doula goes and gets a sandwich for mom and comes back, and so that mom can, rest eat and be nourished and be present in the way that she needs to be. So it might be something like that. It might be a long labor, and it might be times when the doula's not doing anything, just staying out of the way, letting mom be mom, letting partner be partner, letting all those things be. But then also, as labor intensifies, we're trained in pressure points, in comfort measures, things to try to help move labor along. We're trained to understand where the baby is in certain cycles of labor, right? I'm saying cycles, that's not the word, but anyway, some stages, right? Yes. Certain stages of labor, we get to understand that, so then that can dictate what kind of movements, whether we're going to be on a ball or whether we're going to rock, or are we trying to open up the pelvis? Are we trying, so really, what are we trying to do to bring baby down and bring baby out as naturally as possible? We don't impose birth that's not medicated. We don't impose anything. It's all about what that birth giver wants, but we still want to provide them information so they can understand what happens when you become induced, what actually happens in your body, and how sometimes that can prolong labor, or also sometimes cause you to have to go into a C-section because of distress. So to just be able to understand what those variables are, that's the training that we get so that we can share that with the birthing person so they can be informed in real time.
So it's not like it's one or the other. So can someone have a midwife, a doula, a nurse, a doctor?
Great question.
Do they swap out, or are they all complementary?
Thank you for that. So a lot of people don't know the distinction between a midwife and a doula. A midwife is literally a doctor. It is a person who is doing the medical work to bring baby forth into the world. Midwives, there are nurse midwives who do work in hospitals, and there are also professional midwives who work in birthing centers and focus on home births. Either one is a matter of preference. I think that people often choose the latter because they want to have a home birth experience, or because the nurse midwife still has some responsibilities to the medical system and to the rhythm and the times that are set by that. Whereas a professional midwife might be more inclined to do like natural medicine, might be more inclined to, varying massage or breathing practices. And also, when you go to the hospital or you go to visit your doctor when you're expecting, it's a quick visit. This is just how it is, right? But with your midwife, you can actually have more visits with them. And, they can give you more information and help prepare your body for birth. And give you some ideas and some practices that are going to help you be more comfortable in labor, or know how to, your body needs to stretch in order to make room in the birth canal. So what are some things that we can do, some oils we can apply? So you're going to get kind of more of that kind of personalized experience with a professional midwife than you might even get with a nurse midwife, I think.
Okay. That's good to know, because I don't think a lot of people have ever heard those distinctions or understood that they can have multiple points of service to help bring baby into the world while keeping my person safe while I'm doing this major transition. Because I don't think we know how difficult it is to bring baby into a space.
Right. And I remember the first time I was able to witness a birth, and I'm just breathing. You think I was having a baby. I'm breathing hard, and I am just like, what is going on? It's not going to make it. It's not coming out. It's not coming out. It's coming out. And it really is a beautiful miracle. It really is a beautiful miracle. But it's hard, and it's strenuous, and in a lot of ways, it's life-threatening.
Yeah. Yes.
Again, particularly for our Black birth givers.
So let's talk a little bit about that, because we've heard things about how things have impacted the African American community when it comes to infant and maternal health. But for someone that is thinking about having a birth or is in the process of getting ready for birth, what are some examples of poor treatment that they may not know about? Like, I should say I need a doula, or I do need an advocate, or I need to stand up for myself. What does that look like? Or what have you heard people talk about?
Well, I mean, I think we're sort of trained to trust the professionals in the world to have our best interests at heart.
Right.
And so it becomes difficult for us sometimes to advocate for ourselves, because we don't want to challenge the professionals that are in front of us who know this work better than we do.
Yeah.
And so because of that level of trust that's just kind of embedded in us, we could benefit from having somebody else to come in and to help us have conversations about all of the possibilities that can happen at birth, right? So, for instance, sometimes people are going to be induced, and they may not need to be induced, right? I've heard it said that sometimes inductions are scheduled so that there aren't babies born on holidays or on weekends, or unless it just absolutely has to. But if the doctors can schedule your induction, then it's better for them to plan for your birth. That doesn't necessarily mean that it's better for you or for your body.
Right.
Baby is not ready to come out yet, but we're looking at some convenient factors, and then sometimes marking that up to some sort of health factor that might not even be the case. Like, I know one young lady was told that she had to be induced because her torso was too short.
What?
So she wasn't diabetic. She didn't have any medical concerns. But it was just another one of those things where it was like, well, you have a really short torso. So, you need to, we need to go ahead and induce because it's really crowded in there. Or
They say stuff like that?
This is what they said to this person who said this to me.
Wow.
And so it's some of that rushing, that kind of like, okay, let's go ahead and have a C-section. Let's, a vaginal birth, after C-section, a VBAC. A lot of people are like, I don't want to do that. That's going to be way too dangerous to do, when in fact, a C-section is a whole surgery.
Yeah.
And people don't think about it because people have them all the time, but it really is a surgery, and it affects how you're able to care postpartum.
Yeah.
Because you have to heal, and you can't lift, and so you have some of that kind of stuff going on. It also can affect your milk production, and if you want to nurse, and so there's some things like that. So there's just implicit bias, just rude treatment.
Right.
Yes.
Depending on where you are, like I say, if people are racist, on social media, those people are doctors and nurses, and they're professionals in the world. The same attitude and vitriol that they bring, that they spew in their particular spaces, also shows up when they're a nurse, a doctor, or someone else in the hospital system. So there's just that. There's just been, I had one of my older daughters was in the hospital. She called me, had just had a baby, and she's a single mom. And she called me and said, "Can you come? Because this nurse is just so rude to me." And so when I came into the hospital, I knew the nurse because I used to be her pastor.
Oh, wow.
And so the treatment that she gave to my daughter immediately changed. Where now she was kind. Now she wanted to go above and beyond to be able to serve her and to make sure. So that's that implicit bias.
Yeah. Yep.
Right? And so that's probably the biggest piece.
Yeah.
Right. And then, you know, there's cultural dynamics around people's families.
Yeah.
Some people want their whole family in the room, and sometimes the hospitals can be, you know, opposed to that.
Right.
And so there's just a lot of kind of individual and larger scale conflicts that can occur between the birth giver and the actual hospital, especially if they push back some.
Yeah.
And so those are some of the things that can come up that can make it necessary to have someone in the room to lift that voice.
Yeah, for sure.
So I know that because of lack of education and knowledge, there's a ton of speculation and nervousness around, you know, using a doula or a midwife or a home birth. Can you help provide like some insight and give us some understanding of when each one is appropriate, why we should consider it, and how it can be helpful?
Yeah. Well, as I said earlier, I think everybody, every birthing person should have a doula, really, to, you know, just serve you in that way. And even if you're not a trained professional doula, I think the birth plan can help you so that person who is with you can be better informed.
Yeah.
So that's just across the board, hands down. I think that I am biased, and so I do think that having a midwife has so much value, whether it's a nurse midwife, because you do get those extra meetings, you get the extra time, you get that extra care that you may not necessarily get with just your regular physician. So I think that that's a piece that midwives, regardless of which one you choose, will definitely be helpful for. I think, again, if you want to do a hospital birth, then a nurse midwife would definitely be my recommendation. That's their domain, that's their space. And that's where they work out of. Just know that there's still some beholding to the hospital's desire for quickness, desire for whatever. There's still going to be that in place, and they're going to have some commitment to that. The benefit, I think, of having a professional midwife is that is your person, right? And they are dedicated to you. They are available to you throughout your pregnancy, and also, obviously, you know, in your birthing experience. If you want to have a home birth, that's where you want to go. You want to have a professional midwife. If you want to go into a birthing center, because maybe you want to have a tub birth, you know, and a lot of birthing centers do have that. Or if you just want to have that, you know, that intensive care, then you're gonna get that, something that's gonna be more organic, something more natural. You know, you're not gonna have the barriers of, like, sometimes in the hospital you can't eat while you're in labor. I was in labor for 32 hours.
Ooh. Oh my
so
gosh.
With my daughter, so I was hungry, needless to say. And so, you know, so sometimes you can't eat. And sometimes, you know, you can't move around freely. You might want your whole family to participate in this birth in a way that a hospital room is really not as conducive for if you have little kids or something like that. This way, you can do it in your home, or you can do it in a home environment. And this is really the way birthing was supposed to be, right? And thank God for the hospital. You know, we don't want to ever disparage our doctors and our medical professionals, because if you have some complications or some predisposed illnesses, then you really need to have a conversation with your doctor, because you might need to be in a hospital based on preeclampsia, you know, or, you know, some of those sort of things that get associated with birth. You probably, or like if you're at risk for needing a C-section, you know, you probably want to be in a hospital setting for that. But if you're giving birth and you're in good shape, you know, and you really want to have a profound experience, then I really do think that. And then in terms of even expense and the cost, it's so much less to have a midwife. So
I know one of the things that I learned at the conference is that the ratio of babies that die during a home birth versus the ones that die or don't make it at a hospital was
virtually the same.
It was virtually the same. So I think that there's a lot of speculation around that it's just unsafe, and it's like, but the numbers show that that's just not true.
That's just not true.
It's just not true.
Yeah.
So I think that conversations like this is so important to give the information, and I think that that's a lot of the reason why people shy away from it, because we just don't know.
Right,
So what we don't know, we tend to be afraid of. So I so appreciate conversations and things would just offer information.
Yeah.
I think so. This will be my shameless plug for our department and what we do, right? We are all things education and career readiness. So we are not only helping people become doulas, but we have resources now to open that pathway to midwifery. And y'all, it's not called midwives or midwife. It's midwifery. We learned that at the conference.
Midwifery.
Yeah, it's not midwifery. It's midwifery, right? Because some hospitals, we learned, don't honor midwives or they don't honor doulas, but we learned too that as long as every midwife is certified as a doula and they don't honor a midwife, that midwife can shift positions in the space and still stay with mother and baby, or a birthing person and baby, right? So you are never abandoned because of the hospital system, but that advocacy, like you were talking about earlier, that's what you want that person there for, to kind of stand in the gap, because you're like, my body is changing. I can't argue with you and acknowledge my body at the same time.
Right.
I think there's a lot to that. Now, we are almost approaching the end of our time. We definitely need to have you come back and talk some more. But tell us, what is probably one thing you need all of the Black birthing people? What do they need to know?
You need to know that you deserve, and your baby deserves, to have a doula.
Yeah.
To come alongside of you in your birthing experience, so it can be as focused and as beautiful and as crazy as it needs to be, without any other distractions. And you need and deserve a doula because we need you alive.
Yes.
And that a doula really, in my estimation, is a pro-life agent.
Yeah.
Essential. So you deserve it, and so does your baby.
That's powerful.
I love that.
So I will share this with all of you that are now tuning in. And if you haven't tuned in before, I invite you to backtrack and catch up to everything that was shared in the conversation. GRAAHI published a infant and maternal health report back in 2022, which is available on our website. I invite you to read it. It might be a little lengthy, but it's super important, and it's filled with a lot of great data points about what's happening right here in Kent County. I'll share that we are the 4th largest county by population in Michigan, and right now we're still reporting that the Black infant mortality rate was significantly higher than white infant mortality rates throughout the decade from 2010 through 2020. So believe it or not, this is still a disparity that we are all equally responsible for, because we are here to service and keep our community healthy. So the leading cause of death right now in Kent County for infants is prenatal care. So having a doula is a strong solution to that. In addition, the leading cause for maternal morbidity is the intersecting social determinants of health. So that has everything to do with where you live, your perception about your medical care, your understanding of how to advocate for yourself. All those components together usually cause more complications for all birthing people, especially those that are African American. So with that, GRAAHI is launching our very first and initial doula initiative together. Denise is right on board with us to help launch everything that's happening this summer, 2024. If you are interested, send us an email to pathways@graahi.org, and we look forward to inviting you to all of the things that are happening, getting you the dates, the locations, and how to actually apply to join that. So Denise, real quick before we log off, tell us how you're feeling about working with us and getting this started.
I am super excited.
Yeah.
This has started with a small conversation.
Yes.
And I just knew GRAAHI was the place to come to with it. And I am just over the moon. Excited about the work we're going to do together.
Yes. Ashley, how are you feel? Now, you're leading this initiative, right? I'm here to support you, but how do you feel about all the work that you've been doing behind the scenes to make this come together?
Same. I am super excited just about the possibilities and, you know, providing the education and the knowledge that is lacking in the community. It's just really more than anything, when I think about this program and everything that we are going to do, I just feel like we're just giving babies and moms a chance. Like, and like, if we can just give them a chance, then it changes everything. So I'm so excited to be a part of that. I can't wait for everyone, you know, to come and try to experience it and then do your part, you know, and make a difference. So.
Yes.
All right. Well, we thank you for joining us on today's episode. You will be hearing more from the Pathways Department. Y'all have an excellent day.
Bye.